Doctors of Reddit, who was the most entitled parent you've seen in the ER? Please like and subscribe. Thank you. During my surgery rotation in medical school, I was, peripherally, involved in a trauma code in the emergency room. The trauma victim was intubated, had 2 chest tubes, blood everywhere. By the time it progressed to pericardiocentesis, a needle onto the sac of the heart to remove any blood outside the heart, but in the pericardium, that can be the cause of cardiac arrest in trauma. A lady grabbed my arm and pulled me out of the trauma bay, yelling at me that her daughter in the room next door was cold and needed a blanket. Not my last encounter with entitled patients and families, but one of the most memorable. Honestly, the nerve of some people is just ridiculous. Saw a 30-year-old guy who came in with complaint of chest pain. After seeing and examining him, his story sounded like Jerd, but cardiac workup was started. Got called away from the module to deal with a teenager who was shot and ended up dying. When I got back, the guy's mom was there and was irate that I hadn't been in to talk to her in the 15 minutes since she arrived. I tried to explain that his workup had already been started. There were other patients in the department who also needed my attention, and many of whom were far more sick. She lost it, basically said she didn't care about anyone else, and her son was the only one who matters. She wouldn't calm down, and was eventually escorted out by security. I'm glad she got booted. A 30-year-old man should be able to fight his own battles if he felt neglected or underserved to the point he might die. How did the guy react to his mom saying that? Pretty much like you would expect a 30-year-old guy who has his mom go to the doctor with him would react. He sat there and didn't say anything. Last time I was in the ER, a local news anchor came in. I actually did recognize him. He walked by where we were sitting, and I saw him go up to the check-in area and immediately demand to go straight to Tridge. And I heard what you'd expect. Don't you know who I am? A response I wasn't expecting, but made me laugh. I do not, and I don't really care. And something like, I don't want to be waiting with all these sick people. You better not make me wait. To which she told him to have a seat and wait. It was really funny to listen to. It's the second local news personality I've encountered in my life, and both were super loud dicks. I've been on a local channel. If I die from this injury, dozens of people might be mildly annoyed. Not dozens. Maybe a good 9 people will care. Oh god, the humanity. I have to report on a local children's talent show in 2 hours. Do you have any idea what will happen if I'm not there? Another good response would have been, of course, your name of leading news person on competing channel. Then just sit back and watch him squirm because he wants to be seen first, but also is pissed at being less famous. Sir, you don't know who you are? Quick, we better get you a CT scan. You might be having a stroke. If you aren't Ron Burgundy, then I don't give a fuck. Take a seat. Not a doctor, but a nurse and a mom. So this took place in an affluent community in South Oak, California. When my son was about 5 months old, he was in the hospital for a kidney infection. So a sick baby girl is admitted into the next crib, maybe 3 months old. The father was present when the baby was admitted, then immediately took off. He said something to the effect that he was paying tons of money for his baby to be taken care of in the hospital, so he was going to go home and get a good night's sleep with his wife, who hadn't even bothered to show up. Meanwhile, my husband and I are camped out at our baby's bedside through the night. Keep in mind, this is not an ICU or PICU, just a regular pediatric unit. This is not a locked unit and anyone can come in and out through the night, meaning anyone could come in and pick up their baby and leave. Well, as you can imagine, that poor baby cried all night. The nurse did her best, but with multiple patients to care for, she eventually had to call the parents and demand that one of them come back in to hold their baby. They were not happy. I was blown away that they would just leave their baby like that. When my son was an infant, he was hospitalized for 4 days. The baby in the next room had been there 4 weeks. I never left my child's side except to shower, and I didn't see one visitor next door. When my boy was sleeping, I'd go in and keep that baby company. He was maybe around a year old, and I'd read to him or play peekaboo. I felt so bad for him. I was just an 18-year-old kid and still a better parent than the one he got saddled with. Nurse here. My colleague was discharging a patient and, in the process, asked if he needed his parking validated. He sneered at her and responded, "I'm on the board of this hospital. I don't need your validation to do anything." Turns out he was a local philanthropist and multimillionaire, and I guess we were supposed to know that. Seems like a weird attitude for a philanthropist. I always assumed they'd be nice. Hell no. Many people who call themselves philanthropists and are doing it for the tax deductions or because they want to be seen as a good persons and not the actual dicks they are. No, it's pretty much the opposite of that. A lot of rich people are so entitled because they are considered philanthropists. They are easily some of the worst people to care for. They think they deserve everything because they donated some tiny fraction of their income. That's partly because the actual rich people that are philanthropists won't tell you. It's like that saying, money talks, but wealth whispers. Yes, this is so true. Not a doctor, but I had a rather memorable experience. When I was about 21, I began experiencing gallbladder issues. One night, the attack got so bad that I crawled to my roommate's room and asked her to take me to the hospital. As soon as we got there, the nurse immediately took me in for assessment. I was in so much pain that I couldn't talk, so my roommate gave the nurse all my information. The nurse went to get me something for the pain, and my roommate went to call my parents for me, so I was sitting alone in intake for a couple minutes. This lady comes in, literally picks me up by the arm, and leads me back to the waiting area. I didn't even realize this lady wasn't a nurse. All of a sudden, I hear yelling, and I learned later that was transpired was that this lady was actually a patient who was mad that I went to intake before her, led me back to the waiting room, and tried to take my spot in the intake room. She was escorted out by security. What the actual fuck? I'd have called the cops on her and pressed charges. Picking you up when you can't walk. What if you fall and get hurt? Jesus. Going back many years, but my favorite, me, inspect child's rash, it's simpatigo. Mother, what's that? Me, school sores, it's a. Mother literally said, it can't be that, we are rich. Me, mother, can we see someone more senior? Me, get CD consultant to review. Consultant, hello. Oh, what do we have here? Oh, look, impetigo. Mother stares in disbelief, asks to see a pediatric dermatologist as they can't possibly have a paw disease. ED consultant is a super relaxed guy and says yep and calls our most pediatric skin specialist. He is a big deal in the peds dermatology world and he is our weird rash expert. He comes to review the patient. We watch him enter the cubicle. A couple of minutes later exits, asks for a script pad, scribbles his order, goes back, and hands the mother the script, and she profusely thanks him for his time and expertise. She glares at us as she leaves. Dr. Weird Rash Expert turns to us and says, impetigo. I just told her it was an unusual variant that children of wealthy people get when in the tropics. Dr. Weird Rash Expert is also Dr. Expert Navigator of Social Situations. I've been reading How to Win Friends and Influence People, and the way he handled that situation is exactly how the author would recommend. Part of the qualifications for Rash Expert is your speech must be at 100. ER nurse here. Had a minor local celebrity show up in the middle of the night for back pain. He had another man with him, so I asked how they were related. The visitor stated that he was the patient's chauffeur and personal assistant. The visitor then proceeded to inform me of the patient's identity, as if I should be grateful to be taking care of this celebrity. Woo. Go him, I guess. Having not grown up in the area where I live now, this meant I had literally no idea who he was. Honestly didn't care and still don't. The visitor also told me that money was no object and that the patient required only the best care, and if that meant a helicopter to a specialist or whatever, they could make it happen. The ER I work in is a large academic medical center with more specialists than it knows what to do with. We get people flown in to see them, not usually the other way around. Spent the rest of the night running back and forth while he screamed bloody murder over his back pain, and his personal assistant followed me around expecting me to cater to his employer's every whim. 1/10. Do not recommend. TLDR local celebrity dragged his personal assistant out of bed for his back pain, came to my ER, and became my ass pain. Resident doctor. I was working on a surgical ward taking care of the post-op patients. Surgeon calls me to tell me I need to send a script for oxycodone to a young patient who was sent home from theater directly after minor surgery. I have the script faxed over to the pharmacy of the patient. Angry dad calls me next day saying his son is out oxycodone and I need to give him another script. I tried to reason with him that if he's using that much oxycodone he needs medical review before he can be issued another script. Dad wouldn't have it. Said I didn't do my job as a doctor to take care of his kid after the surgery. He then proceeded to file a formal complaint against me. All I did was give his kid a script and told him to see his family doctor if he needs more pain relief. Somehow I had the gut feeling that the patient wasn't the one taking the oxycodone. My mum and I were sitting in the ER because it had comfortable seats and a boy about 15 came in with his mum and he was screaming crying and she was yelling. He got the glue that people use for braces on his penis and a toilet paper roll was stuck to his foreskin. She kept yelling saying, he needs fucking help, ripped it off, it's hurting him. My mum and I died because obviously this kid had a winking accident and the glue was burning his penis. The mum told my mum to shut the fuck up, but my mum didn't fight and just kept laughing. I had a lady yell I wanna talk to your manager because I refused to give her the Heimlich. I had some teenage brat say she wanted to speak to my manager. I laughed out loud at her and said that this is a hospital not a McDonald's. Lol, as if anyone who can yell needs the Heimlich. Obligatory, not a doctor, but I worked in a pediatric ED for a bit. Once, at the start of my shift, a mother asked me if I could get a cup of water for her child. Since some patients are supposed to be NPO, I told her I would check with the doctor. Before I could say anything else, the mother screamed, "You fucking useless ginger bitch," and threw her purse at me. She had terrible aim, and her purse split open all over the floor at my feet. I just walked away when she told me to pick it up. She screamed at me one more time, and by now the rest of the unit was just silently staring at her. Security was called, and she eventually had to be escorted out of the building with her kid because she was refusing to leave without her child receiving antibiotics. He was there for a cold, was told to go home and rest. I felt so bad for the kid. She spent the entire day refusing to leave and asking for different drugs for her kid, ranging from penicillin to Percocet, and becoming more and more irate when she was told no. So asking for water and not being told yes straight away set her off. But I was known as GB by my co-workers for the rest of the time I worked there, so got a funny nickname I guess.